Well, Dr. Lall, thank you so much for being here today. I would love for you to start by just telling people who you are, and I will go ahead and do the spoiler alert and let everybody know Dr. Lall is my amazing and intelligent primary care doctor. So I'm totally biased, but also super excited to have you here today to tell the story of DPC.
Thank you for having me today. I appreciate your praise and compliments.
Yeah. Well, before we jump into DPC, tell us about you. I mean, you're a little bit
Okay.
unique in that you've got a
Yeah.
fellowship and
Mhm.
just tell everybody if you had 30 seconds to say who Asha Lall is personally and professionally, who is that?
Okay. Well, I'm a Texan. Have mostly lived in Texas. Went to Texas schools. I've graduated medical school about 30 years ago, so a long time ago. And I am family practice board certified. I also have done an integrative medicine fellowship. That was done about 10 years ago, just because I wanted to know more in-depth information on nutrition, wellness, supplements, integrative and alternative care for patients. Because so much of what we are trying to do is to not only promote good health but healing, and so a lot of those factors are important for healing, and so that's kind of what I do. I do primary care with an integrative approach, so it is very kind of melded it together and seamless. Some people don't want to do that, and I don't have to. And other people are really wanting to get in depth, so I can do whatever is suitable for the patient.
Yeah. I actually love that about you that you're like, no, lady, you need to take antibiotics for this. But then the other things you're like, you can use olive oil for this. So I know whatever you say, I should listen to.
Well, thanks.
Yeah. So you've practiced both in a traditional setting and in DPC. Can
Mhm,
you share with us how DPC has allowed you to practice a little bit differently? And not that traditional is bad, because
mhm.
I think doctors are trying to do the best they can wherever they're
Yeah.
at. But what do you love about DPC?
Yeah, so I think the biggest thing about DPC is it's kind of like old-fashioned medicine. So back in the day when the GP had their home and kind of had their shingle hanging out,
Hmm.
they knew their community, the community knew the doc, and the doc knew the family, the doc knew, the kid or the person or their kids. And
Hmm.
so there was that relationship and that trust, and that is built on communication. It's built on having time to really get to know, the patient, and for the patient to get to know the provider. For us to be able to kind of figure out, how do our philosophies align? How do you need me to work with you? Because everybody has a different approach and different comfort level, of what they want, and different goals. And so I think DPC is really great in that we can kind of do that. We can practice the old-fashioned medicine or slow medicine, as one of my
Yeah.
providers at the integrative medicine had called it. So that I think is what's really important. Um, I think it's really unfortunate that our system of medicine is so you know numbers based. It's based on how many patients we see, how we're going to get reimbursed, by insurances. So that system doesn't make it easy for doctors, and it doesn't make it easy for patients. It's the middleman, and so I think it puts patients and physicians at a disadvantage. And in DPC, we cut out the middleman, and so we're just direct, patient to doctor. And so that's, I think, the big difference.
Yeah, yeah, I love the way you describe that as kind of old-fashioned medicine because in today's society, what a gift to have a doctor that actually knows you and that you're actually comfortable with and you see regularly. I mean,
Mhm.
it's a rarity now.
Yeah. When I think it really helps patients, and me, because like if you called in and said, "I've got XYZ," well, I know your history,
Right.
and I know, oh, you can do this or not do that, and so I feel more comfortable. You know me, we already have that kind of
Mhm.
relationship, and so I think that is really important. Um, and we can do that. I cover my calls. So if somebody messages me on Spruce app at 10 o'clock at night, it's me going, "All right, try XYZ," or, "I'll see you tomorrow." And so
Mhm.
that it really reduces the chance for medical errors because there's not someone else who's involved. There's not an on call physician who doesn't know the full history or anything like that. So I think that's important.
Right. Yeah, most definitely. So let's talk about scope of services.
Mhm,
Can you walk us through what all is typically included? And that
mhm.
that 10 p.m. text is a great example.
Yeah. So we're family practice. So that means kind of full scope of preventative services. So annual exams, including female exams, so breast exams, Pap smears. A lot of women, like I have to go to an annual, I have to go see my gynecologist. Well, we can kind of do all that together. And then, of course, acute care. So someone has a sore throat or UTI, we're doing it right away. We can get you in. So like urinalysis, urine dips, those are included. Strep, rapid strep tests. So some of those are included in the services. Also, we can access patients can access us through text. So if they're in the middle of something and they don't can't really talk on the phone for privacy's sake, they can text. We can text back and forth. We can do phone calls. We can do video visits, and we can do in person. So ease of access, or I've had patients who've called me from, Oregon. "Hey, I'm in Oregon. I've got UTI symptoms. What do I do?" "Okay, find your pharmacy," So,
Right.
so I think that's helpful.
Yeah. Do you find, especially since you guys are family
Mhm,
medicine, that you're able to work really the full spectrum of your scope as opposed
mhm.
to a, clinic where you've got
Yeah.
7 to 10 minutes to see a patient?
Yeah, so because of insurance billing, if someone is coming in for an annual exam and they have an earache, or they have a spot on their skin that needs to be frozen or looked at, or um, you know, the providers, because of billing, they can't do that. So they're like, "Oh, I'm going to see you for your annual. Go ahead and make a separate appointment to come in.
Mm,
Let me check your ear." Or so it eliminates some of that repetitive
mhm.
need for patients to kind of come back and forth. Um, and often in regular primary care setting, if a doctor wants to do a procedure,
Mm,
so if I see something and I'm like, I'm going to biopsy this because I
mm,
think it could be early skin cancer, I can do that
mhm.
here. So I can, and that's one of the other services. So skin biopsies,
Okay.
yeah. So and like freezing precancerous lesions or things like that. So there are a
Mhm.
lot of things that I can do that I don't have to have a patient come back and forth, waste my time, waste their time, and just make it
Right.
more efficient. Yeah.
Yeah. Yeah, definitely. And do you find when it comes to preventive care, I think in a perfect world, family medicine is the place where that happens. But
Mhm.
now a lot of times you're, putting out fires. So do
Mhm.
you feel like you get the time to address more preventive care in DPC?
Yes. Hands down, yes, yeah. So sometimes, patients have unfortunately had negative experiences, in other practices, or they just don't feel a connection. They don't feel like their provider is listening, that they're maybe as engaged as they could be, or their value of medicine, their idea of medicine is a little bit different. And so we have time to kind of explore, what are some reservations? What are some things that you maybe holding you back from your best health? How do we address that? And then we can kind of go from there.
Yeah,
So
that makes a
meeting the
lot of
patient, yeah, meeting the patient where they are.
yeah, that
Yeah,
must be so nice to have the time to do that.
it really is. Hmm.
And then what about your patients with chronic conditions? How do you handle them in this environment versus how you might have had to in a traditional setting?
Yeah, so I think here I again it's time, and I have time to not only be able to say, hey, you've got high blood pressure, it's so high, you need to be on medicine, but hey, let's look at some other factors that could be contributing to your high blood pressure. Maybe you need to have a better nutrition. Let's talk about what kind of movement or activity you can start doing. Are there some stress factors that we can address that would help alleviate blood pressure? And sometimes what's really important for patients is just to be able to tell their story. And so once a patient feels heard and they feel acknowledged, that is very empowering. And often patients can then kind of feel empowered to just move on and take the next steps that they need to. Um, and so I think that's a really good thing about DPC is that we can do that.
Absolutely. Yes. In my consulting practice, I see that so often, especially with patients with chronic pain
Mhm.
or where they've had a misdiagnosis and you don't have time and frankly probably don't want to hear the story. I don't want to hear the
Mhm.
story, but they need to get it out. And then once
They
they
do.
know that you know that then we can start over and try
Right.
things.
Yeah. Yeah, they kind of, I think, feel that maybe, you got their back, you know where they're coming from, and so I think that is really important. And I think it's really, frustrating for a lot of physicians as well, because I mean, most people who go into medicine, they are people who care about people. They want people to feel well, they want people to do well, and when they're in a system that doesn't allow that, it's quite frustrating, and sometimes that comes out in ways that aren't beneficial for the physician or the patient.
Yeah, definitely. I feel like it's hard to have a direct primary care conversation without it sounding like we're attacking traditional primary care. And I just want to be
Yeah.
super clear that we're not. Those
Oh, no.
physicians or
No, no.
victims of the system as well,
Yeah.
and would love to
Yeah.
spend an hour with patients.
Oh, yeah. No, I agree. I mean, some of my really good friends and colleagues are still in traditional practice, and sometimes patients need that. They need really, really, intensive care or like, internal medicine care. So I am happy to refer them. I have patients who do see specialists, and I'm still their primary, and I can still help coordinate their care, and then just let them have a place where they can bounce off different ideas, so they feel like someone is kind of looking out for the whole person. So I no attack against any person or specialist, but the system is broken in general, so hopefully it's something that can eventually improve.
Are there any other things that you'd want people to know or things you want patients to know or even employers that are thinking about it?
Yeah, I think the main thing is that, DPC is here, um, and I think patients often are like, "Wow, I never knew you guys were here. I never knew something like this existed." And so I think that's the hardest thing is it's real. It's not a fairy tale, Um, so I've literally had patients say that, like, I can't believe that this is real,
Yeah.
with the
And affordable
Mhm, and
for
affordable, yeah.
a couple $100 a month, a
Mhm.
family can have this kind of care.
Yeah, yeah. So I think that's the other big thing.
Yeah,
Yeah.
definitely. Well, if folks are in the Austin area, they should definitely check out Euphora Health or holler at me. We have lots of good DPCs in town. And then nationally, I think is the DPC tracker probably the best place to find them through the DPC
Yeah.
coalition.
Yeah, DPC Finder, I think, or DPC Locator, one of yeah. So that is still the best, that's constantly updated, and I use it for patients who are moving out of state.
Oh, nice. Nice. Awesome. Well, thank you for your time. Thank you for all the passion and brain work that you put into patient care every day and for carving out a few minutes to share with us your story.
Thank you, I appreciate the opportunity.